So your ultimate goal would still be repeal of this law. Is that true?
That is true, but I recognize reality. Obamacare exists. People are on the policies right now, so it's not a piece of paper now that you can repeal and just goes away. We have to deal with that reality. So what I've been trying to get my colleagues to agree to is, because the Senate won't pass it, but the House might, is a transition piece of legislation that the working title is Preserving Freedom and Choice in Healthcare. It's designed to do exactly that. The number one component of it would be to eliminate all the mandated coverages. That's what's causing millions of Americans to have lost their health care, plans that they liked that they could afford. It's also what's driving up the cost of health care. So there's a couple small, limited elements that we could do to a transition piece to really repair the damage that's been done by this health care law, limit and prevent future damage. In other words, what I'm proposing would actually protect patients, make health care more affordable. Show the American people what we're for, that would set us up and put us on a glide path for real free market reforms. It'd be more patient-centered, that would actually preserve freedom and choice in healthcare. Because that's the problem with Obamacare. It's just so coercive. It's not about freedom and choice. It's about the geniuses in Washington telling you, what your treatments are going to be, what kind of insurance you have to buy. Mike, I just have more faith in the American people to have the intelligence to be able to make those decisions themselves without bureaucrats in Washington doing it for them.
Although, as we saw, many people have not had insurance. So apparently some people haven't done that. Is that not the case?
Well, that's true, but that should be people's own choice. Listen, if you want to take care of people in terms of pre-existing conditions, have a strong social safety net, I think the way to do that is with high deductible plans, major medical plans, and if you have that kind of plan and then you combine that with high risk pools, you can take care of those pre-existing conditions, and that can also be the social safety net. And what's interesting about this right now, Senate Democrats are saying we got to fix this law. How they're going to fix it is they're going to offer a copper plan, which is really going to be, according to President Obama's standards, a really substandard plan, but they have to offer a very substandard plan just to get the cost of health care down because of all the other elements of Obamacare that drive the cost up.